Well, let's go ahead and get started, and I'll just watch the door to see who else comes in. Thank you all for joining us today. I'm Carrie Henches, and I work with University of Life on the SciTech campus. And so October, we celebrate Exercise is Medicine Month on campus. And so with that, we've been working with kinesiology and Dr. Stroni to really promote the idea of working out on campus, getting students involved with maintaining their health and exercise, and then in turn, faculty and staff. Deb, if you are with us, we would love to have you do an introduction.
I'm back. As Carrie mentioned, it's Exercise Medicine Month on Campus Month. Exercise is Medicine has a community designated month in May as well. And what we wanted to do with this webinar today was to highlight the program that was started at the Freedom Center that does incorporate the community, but also since it is on the Mason campus, we've had faculty and staff involved and students that are involved with the program, and just really showing like what this really could be. So with On Campus, it's an initiative to view exercise as medicine, to use it to improve our physical health, our mental health, prevent chronic disease, that when we follow those guidelines that are given to us, that it really does help in that sense. So I will actually now pass it over to our speakers today. So we have Ms. Tammy Rowland and Robin Frey from the Freedom Center who initiated this project. And they'll talk to you a little bit about what it is, what some of their goals are, and kind of where we're at today.
Okay, so is it my turn? You want me to kick? Okay.
Your turn, Tammy. Sorry. So if you each want to do a brief introduction, and then we'll jump into the PowerPoint.
Okay. I'm Tammy Rowland, and here with my colleague, Robin, who's a fitness director and at the Freedom Center. And I am the community care coordinator, and I'm also the health and wellness coach there. And let me go ahead and share my screen here. Okay. So as the community care coordinator at Freedom, in addition to working specifically on the exercise medicine program, which we're going to get into today, I work on connecting the needs of the community with the programming that we're able to offer at the Freedom Center. And that oftentimes includes collaboration with outside organizations, because we can then provide programming for free or reduced cost. And examples of those are partnering with the county to do self-management programs. We provide the space and they're free to members and non-members. We also provide, we had a partnership with the YMCA to conduct the CDC's diabetes prevention program. And through them, we were actually able to acquire a grant to basically scholarship people in that program for those who don't have Medicare, which will actually cover that. So we're more than just a university fitness center. We provide fitness and recreation opportunities and this community style programming to all ages, all levels. And so we're definitely committed to improving the health of the community. And we continue to explore ways, excuse me, of that collaborative type programming and additional partnerships, which is what brings us to the exercise medicine program. We do have a partnership with the American College of Sports Medicine, and I think there might be 10 at this point, people who are partnering with them in official capacity to that meet certain levels, certain standards of the exercise medicine program. And we're one of them. So we are thrilled to talk about this with you today. Before I get into the details of the programming, just to give you some perspective, some backgrounds to why this type of programming is so important, as well as the on-campus, is just, looking at these numbers. About half of American adults have one or more preventable chronic diseases, and 7 out of 10 of them can be favorably impacted by increased physical activity. So, nearly 80% of adults are not meeting the key guidelines that Deb mentioned, and about half aren't meeting the guidelines for just any kind of aerobic physical activity. Physical activity is effective in prevention and treatment of a variety of chronic diseases and conditions. And despite these benefits, the levels of, as you can see, the levels of inactivity they're alarming, and they're very costly to our medical system. So you can see those statistics on the screen. And it's estimated that adults spend about 8 hours in sedentary behaviors. And I would venture to say that's probably increased, especially with the pandemic. So there are several benefits to physical activity. You can see them there. You all are probably familiar with them because they're everywhere. The statistics, the numbers, the talk, and you probably experienced them yourself. The improved sleep and cognition, and just the overall quality of life. And so I guess the bottom line here is just that regular physical activity is one of the most important things that people can do to improve their health and maintain their health. So feel free to get up and move. So in 2007, understanding the risk of the increasingly sedentary lifestyles and the benefits that physical activity can provide, the American Medical Association and the American College of Sports Medicine created the Exercise Medicine Initiative. So this global initiative is based on the physical activity guidelines set forth by the Department of Health and Human Services, which recommends 150 minutes of physical activity or more per week. And so that's easy enough, right? 150 minutes, done. Except, why are we not getting enough physical activity? Why is it still so hard? Well, oftentimes when you're dealing with an issue and you go to your doctor to get treatment, they offer you a prescription, medication, or maybe surgery, some sort of therapy, and they manage that. And that's easy, or not easy, but that's something that you can buy into, and that they're going to help manage for you. However, when the treatment involves increasing your activity, improving your nutrition, you leave that doctor's office usually with the best intentions, but what do you do with that? How do you know how much exercise, what kind of exercise, and what do I eat? What should I not eat? And how can you get the support to actually implement that? And so that's what's unique about this is the doctor oftentimes cannot guide you in that and provide you the support that you need in that 15 minutes, other than telling you that's what you need. And so where we come in is after that doctor has assessed your activity level and your risk factors, whether you have a chronic condition diagnosis, they prescribe you exercise based on those risk factors or your current health status. And then they're going to refer you to an E.I.M credentialed facility. In this case, that would be the Freedom Center. So that's what's unique about this program, is that we start at the clinic setting and then it moves into the community setting. And that creates that continuum of care where the fitness professionals and the coaches, they complete that cycle and they provide that support that you need to kind of get that individual care. So once you get to the Freedom Center or that community setting, you encounter the community care coordinator. And what happens then is you assess that baseline data, that information provided by the doctor, whether there were risk factors involved, and confirm that medical clearance, because this program does require medical clearance from your provider. And that person takes it to the E.I.M team, and together we determine the appropriate exercise programming. So you can see this is a targeted program that looks at the individual and then provides that prescription for them. It's a team approach, and we simultaneously work together with that client to provide the exercise prescription. And these trainers that provide the exercise prescription are credentialed in the E.I.M, which basically It provides they follow the condition management guidelines to exercise prescription that focuses on the exercise response to the different chronic conditions as well as medications, but they do it with emphasis on applying the safe exercise progression based on that individual. And this minimizes the risk and gives them a structure to follow and so that they can have a positive experience. Again, it's individualized to their needs. As far as the lifestyle change coaching and the nutrition education, which is simultaneously happening, it's based on behavior change theory. So in addition to educating them in whatever aspect of nutrition they may need assistance with, it incorporates a sense of autonomy and provides a sense of self-awareness. There is goal setting, behavior reinforcement. And again, this is a collaboration with a coach, and it is driven by the client to address their needs. The goal is to increase the self-efficacy of that client to sustain these healthy behaviors. So again, at the Freedom Center, we combine those three major components of nutrition, education, the lifestyle behavior modification, and the exercise prescription. If any of you were on earlier, you heard, we have the facility to provide for people to come in and work with the trainer and then come in outside of that to get their physical activity in whatever format they choose, to include the pool. And of course, with COVID, we had to kind of put a halt on that because we closed down for a little while, but we were actually able to transition into a virtual model that allowed us to work via Zoom and have those people work continuously with their trainers on Zoom and get that guidance even while they were doing their activity, whether it was watching a video at home, going outside for walks or runs or whatever. We were able to kind of seamlessly transition into that model. Hopefully we'll get back to a regular model just like everything else, but we were able to do that. I'm actually going to have Robin go into a little bit more of like what the program looks like at a glance for a client to go through the program. Before I hand that over, though, I just want to highlight the long-term goals of this program, which is to create a model for other facilities to implement. We want to be able to serve more people, a larger population within Prince William County. So we would like to take this model and have other facilities implement it at their organization to be just another site for E.I.M and another place for doctors to refer. We obviously want to see those improved chronic disease indicators, improved glucose, so the A1C, improved blood pressure, and these types of things. We also want to see more physicians referring to the program. When we have more physicians referring to the program, whether it's word of mouth or clinics that we've partnered with, we know that the program's working and we know that people can benefit from it. So we would like to see this increased number of physicians referring. So at a glance, Robin is going to kind of walk you through what a client would experience when they're going through the program. Robin?
Thank you, Tammy, and welcome everyone to our meeting. I am Robin Fry. I'm the fitness manager, and I kind of head over the exercise department and exercise prescription for this program. As Tammy said, our goal for this is we have to step aside and not look at this as fitness or weight loss, which is very typical in a gym setting. This is more about a systematic approach to training from the inside out, and it's simply for health. So when we look at biometrics that we're measuring, it's not necessarily fitness gains, but it is gains in, decreased blood hypertension, hyperlipidemia. We look at cardiovascular disease and diabetes. Those are the four in particular at this time, although exercise as medicine does address a lot, as Tammy said, mental health. There's so many areas in this program that we will be developing into in addition to what we're currently focusing on. So we're going to take each person and we create what is an activity fitness assessment, but again, it is not necessarily fitness. We're looking at what motivates them. We're looking at movement patterns for risk injury. We are looking at their ability to exercise with certain medications or what's inhibiting them in terms of being successful, even with 150 minutes of exercise a week. Then we take and create specificity in that. For example, if we have a diabetic person or someone who is prone to diabetes, because literally exercise as medicine is geared towards prevention more so than maintenance and dealing with the after effects of being diagnosed with these diseases, although we do have both. So we take that specificity and we create exercise prescription that will benefit that particular person in terms of their lifestyle, their ability, as Tammy said, to get to a gym or not, what's most important for them to create a better environment within their bodies and within their immune system to try to create an environment where they're not going to get diabetes, they're on the borderline, or we decrease medication, which is a really big goal, and we've seen that. So we do a basic assessment. We go over a very comprehensive medical history. We review medications that do or could have a response to exercise as well. And all of that is for the safety of the client. When we say training, I prefer not to use that we are working as trainers. We're working as coaches to allow these people to develop exercise prescription and formats that, number one, they're confident because self-efficacy is our goal. They can conduct them safely on their own during the virtual training, and that this will be a long-term understanding because the education behind what they do physically really makes it relative to each individual client. So we do, we want to decrease sedentary lifestyle. I'm not sure, I would assume most of you are familiar with NEAT, non-exercise activity thermogenics, active daily living. We really developed that process where even though you sit for 8 hours a day, you don't have to sit for 8 hours a day. The simplicity of that is something as simple as a 3 for 30 rule. Every 30 minutes that you're sitting as a student, as a teacher, at home, get up for 3 minutes and move. Sounds simple, but it's very effective. We want people to know the big picture and the small things that they can be onerous of to create a less sedentary lifestyle. Improving biometrics is very important as well. Typically, E.I.M works a 12-week period and then it continues for 9 months. Most of these biometrics will not change in 12 weeks. So we're looking for working with these people post the 12-week period as an intervention. And we're there to, make sure that we follow very specific guidelines. ACSM, basically what we use is chronic disease and disabilities textbook and information to provide exercise prescription for these people. Thank you.
Thanks, Robin. And as you can see, the intervention part, we call intervention, is 12 weeks, but we like to see people move from that 12-week, as Robin said, there's a lot of learning that goes on during those 12 weeks. That's kind of where they're building that knowledge and those skills. So, whether it's through use of activity logs, food logs, these types of things, again, targeted to fit that individual. Beyond that, we won't see those numbers change at 12 weeks, but beyond that, we hope to see the independence. That's when we know they've built that self-efficacy, that confidence, in addition to that knowledge to continue whatever those activities are, that increased physical activity and those healthy behaviors, whether it's their diet, sleep, stress, anything around, these are going to improve their functioning and help them to sustain these healthy behaviors. So thank you for that, Robin. Whoops, wrong way. So the global exercise medicine has this call to action that essentially calls for organizations to support and advocate for physical activity as essential to health and well-being. You can see that it involves organizations at all levels. So from the individual level to the organizational level, on up to making systematic changes. And so we hope to be able to impact this somewhere along the line. And right now, Freedom Center is starting with that organizational level by implementing this 12-week intervention and as the community partner in this. And but I also want to highlight our involvement with the university. So, as you know, we are part of George Mason University, And I'm not sure if she's still on, but Dr. Stroney in kinesiology is, we're partnered with her in the way that she, not only is she with the on-campus, so she's running that aspect of things, but we work together to build the research. So we actually do have IRB approval for collecting the data from the folks that are running through the program right now. And what that'll do is, again, Dr. Stroney is assisting with that research aspect of it, as well as providing us guidance from the kinesiology perspective. And right now we're collecting the data and we're compiling. We've just run our first cohort through the program, and we're taking the information we gathered from that initial cohort, and we're compiling it in order to, it's kind of the preliminary data, and we're going to be presenting this. We'd like to submit an abstract to the American College of Sports Medicine so we can present this early next year. And again, like I said, it's preliminary data because we will continue to collect data from this program as we go along, and there's several purposes for that. It provides us the support the information, the background we need to present this information to the community, to gain involvement, to get those partnerships with those physicians, to increase those referrals. It also allows us to obtain additional funding, which is a critical piece in providing this program when we talk about accessibility. So right now, like I said, from our initial cohort, we were able to transition to the virtual format. But it did halt some of our ability to obtain funding, as I'm sure a lot of you have experienced for the same reason, just finances or funding being redirected to COVID relief, understandably so. So we're back at it, and we are working on obtaining that funding. That will allow us to provide scholarships for folks so we can create this level of accessibility to all members and not allow the cost of the program prevent folks from doing it if that, participating if that's what they need. So at this time, we continue to run the program as a self-pay program. So we do have that option. So if it is something you're interested in, I have my contact information that you can reach out to us and talk to us about, whether this would be a good fit for you. And we'd love to talk to you. We are also continuing to explore additional partnerships within the university. We would like to see this expand in the way that we could provide an opportunity to work with faculty and students alike to either contribute to or learn from the experience with the lifestyle medicine in the field of lifestyle medicine, whether that's through educational workshops, contributing to the field of knowledge, or working directly with clients in some way. We'd like to build upon that to create those opportunities so this can grow, and it just expands our opportunities to give back to the community through this programming. So with that, I'd like to close out. I want to thank you all for your time. And I guess we can move into questions if anybody has any questions. And again, I have the contact information on the next slide, and I assume that Carrie can get that out to anybody who's interested.
Yes, most definitely. I can send out your contact information to everyone who signed up today. But we'd love to hear from you all if you have questions about the program or how you could get involved, or just general questions about exercise.
Carrie, if I could just add, if there are students looking for things to do, I mentioned before, we like to give educational workshops. Right now, it's a little bit easier of a format because you can create one, whether we do a Zoom like this or something, but we do look for in the field of, if it's nutrition or lifestyle behavior or the exercise in those fields. And if there's an opportunity for someone to work with one of our team members to create that that's an area that folks can contribute to. And I saw a question. Is there?
Yeah, I'm very interested in this program, and I already speak to my doctor because I had my last visit and we were trying to, she suggested for me to do more exercise, and some medication has been changed. What exactly is needed from the physician? Is there any format, special, what needs to be done? Because I requested, some type of referral for this program, and they ask, what exactly it's needed to say, or what the format requirements, so they can provide it to me.
Okay, great question. So at this time, what you can do is, I think you've already got the ball rolling actually, but you can contact me. I am the community care coordinator for our program. So if you send me an email, hopefully you can see that if it's still up on the screen for you guys. And if you let me know, then what I will do is I'll help you get the process started, and I'll send you our informational flyer, and that what we call that it's the prescription, it's the physician's, I'm sorry, the referral, although it's also kind of counts as that medical clearance, and you'll take those forms to your doctor so that they can, first of all, the flyer will kind of inform them of what the program is. And of course you can talk them through it now that you've kind of, we've walked you through it here. And so they'll see that, and then they can, if they just sign that form, and then you can bring that back to us and we'll get that whole process started. We also send you a medical history form and a physical activity readiness questionnaire, a PARQ. And those are for you to fill out. They don't require a physician's signature, but those are for you to fill out. So we have an idea, and we kind of take that information. That's where that process starts of talking with the team members, and we get back to you, and we start from there. So the first step for you would be just to contact me and let me know where you are in the process.
And what is the cost of this program? And
when you email me, oh, that's okay. When you email me, I can send you and it's another informational piece that gives you the breakdown of the cost for the 12-week program, in addition to what services you'll be receiving. I'm not sure. I'd have to check with Robin. I'm not sure if that's up on our website at this time, but I will certainly send that to you as well when you contact me, so you can see it all laid out for you.
Okay, thank you so much.
You're welcome.
I have a question for you on your exercise. I'm just curious. And first of all, I'm very happy to hear you're interested. That's a wise decision for you. Are you currently exercising at all?
Yes, I started, to do the yoga, and I increase it from once a week to twice a week, but apparently it doesn't help much with my high blood pressure, and I just needed, to get an extra medication, which I'm not happy. I'm trying just to change my lifestyle in terms of nutrition and exercise to hopefully get back to my normal.
Okay, thank you. And as we've been discussing, there are specific types of formats of exercise that will certainly help you. So thank you for sharing that. Thank you.
You're welcome, sure.
So I have a question for you all. I think this program sounds amazing, and I think it's great that you were able to keep going even during the pandemic. In an ideal world, do you all see this being a program that's solely for those who have chronic disease, or do you see it expanding outward to general public looking either to better their routine or create a routine where they don't have one?
Well, I'll start to answer that, and I'm actually going to throw that over to Robin because that's her field. Right now, part of the process is to, and I don't want to say qualify for the program, but yes, we are looking for people who are at risk or high risk for these chronic diseases: overweight, obesity, type 2 diabetes, hypertension, hyperlipidemia, these kinds of things. And those who are not getting that 150 minutes of activity, who cannot get it into their lifestyle. part of the process that I was discussing just a minute ago is to kind of go through that and see where you are in that, you know, where you are with your exercise and activity levels. And again, going back to that, that risk assessment. This is targeted. We have credentialed coaches to work with you given these conditions. If someone comes to us and is really, you know, already doing kind of a lot of these things, but is just struggling, we may recommend that there's another program within the Freedom Center that they can take part in, or that they may benefit from certain classes or benefit from working one-on-one with either one of the trainers or the health and wellness coach, myself. So we kind of assess that on a case-by-case basis, but we do look towards those who are getting prescribed by their physicians. One aspect of that right now is until we get a good source of funding in, we've had several conversations with clinical groups, with the physicians themselves, who highly support the program. Our problem is that once we kind of open those floodgates, the physicians have a lot of folks to refer to us, and what we need to be able to do is provide that financial accessibility to these folks. So most of the clients that we've been working with up to this point have taken the information to their doctor and gotten that referral. So we've done it a little bit backwards, and so which is also helping us to gain that the physician support of the program. And so if that makes any sense. So these physicians really, ideally, they're actually referring those clients that they see clinically would benefit from this this program, who are capable of working with the fitness professionals, but would really benefit. And again, we have several programs at Freedom and opportunities for folks to do something, you know, in perhaps that might fit their needs better. Robin, if you want to add.
Sure. Thank you, Tammy. And Carrie, that's a great question, because in truth, this is a very big global initiative. Because what we're trying to do is, when you look at the big picture of, as Tammy said from the very beginning, the trillions of dollars in healthcare costs, what's happening at this point, 4% of someone's doctor's visit is spent on even conversation regarding physical activity. 4% of that time. And yet 80% of healthcare costs are reactive, not proactive. So the whole point of this is prevention. It is preventative care, so that not only our country, but globally, these healthcare costs go down, the quality of life and the shortened morbidity, morbidity due to obesity and all these things that are very systemic. This is the whole thing. So it is actually a very, very big picture when you look at it, but we have to filter down to where we start our level. As Tammy said, funding that we can get, because a lot of these people, you're looking at sliding scales, you're looking indigent, you're looking at cultural differences that just simply don't, number one, have the funds to do these things. And there's no access to knowledge or care. As I said, 4% of a doctor's visit to say, yes, go exercise, they leave there and it doesn't happen because they don't know what to do. So it's a very big initiative, and we're a small part of it right now. But as Tammy said, we are one of 10 organizations in our country that have partnered with the ACSM. There's a lot of medical fitness out there. You can Google it and you'll see all different kinds of medical fitness and marketing towards that. This is the highest standard. That's why we chose the ACSM.
Robin hit on a good point, and the accessibility part of it. Right now, and I think I mentioned this, insurance doesn't cover this type of program. It does not cover, going to a fitness center and working with a personal trainer or getting health and wellness coaching. There are programs through Medicare that do cover these types of services in a clinical setting. So maybe being coached similar to the diabetes prevention program, but getting it from clinical professionals. So, an RN or, a physician's assistant or something in a clinical setting. And you have to meet certain benchmarks, and that's going to be covered by Medicare partially. So we're very slowly starting to move into that arena. You know, in my dream world, I would love for them to be able to cover this kind of thing. I know that there are bills out there trying to get that same type of services that we provide covered in a community setting, because we have the time and the very specific training to work with folks, and it is less costly than getting that kind of service through your doctor. And that's what makes this works. But to make that shift is challenging, and we have to prove that it works, and we have to shift that mindset. And so by continuing to provide this program, and continuing to gather the data, if we share it through our resources at ACSM and the university, which we feel extremely fortunate that we are part of the university, that gives us the access to the innovation of the university, the research and the faculty of the university, and of course, getting the assistance from students. We have, I think, we just talked to Deb. She has a student who wants to be a part of, you know, the research. And so, you know, by incorporating these benefits that we can get from the university, we're able to, I guess, make a larger imprint here in this kind of, you know, working on changing that mindset and getting, you know, someone to kind of, to be able to shed some light on it. We do have a medical advisor. It's actually part of our agreement with ACSM is to have a medical advisor. Our medical advisor is the university faculty. So we do have these resources, and that's really the key, is to be able to be accessible, so that so we can serve more people who are really in need of these services.
And thank you so much. I feel like that perfectly answered my question, so I appreciate that. How large was your initial, is it like a test group that you first ran? And then how big do you want it to get on the SciTech campus?
So it was our initial cohort, our first group that we ran through. We ended up with 11 people because I think it was probably into the first week that the pandemic struck and we had to shut down. So we had folks that hadn't even come in to do their exercise assessment. So we had to definitely shift gears. We had to find out if people wanted to continue to do it 100% virtually. So we were lucky in that most people did. We only had a few drop out because, as Robin, I believe, mentioned earlier, socialization is a big part of this, because that can be a huge motivating factor for a lot of folks. So we had some people who did drop out, but so we had 11 folks. And the thing about our research is that our program's open. You don't have to be a part of the research to come in and be a participant in the program. It is completely voluntary. The program is administered exactly the same, whether you choose to be a part of the research or not. I'm happy to say that everybody chose to be a part of our research just because, you know, I think a lot of folks understood what this could contribute to on a larger perspective, and we're very appreciative of that. So yes, we would like to continue to do this. I mean, our goal, as you all know, especially those of you who do research all the time, 11 is not a very large number. And so we would definitely we'll continue to invite people to be a part of the research as long as we are running the program. And you know, again, the goal would be to be able to get a large enough database so that, you know, we can confidently, you know, show this information and present the outcomes as being a program that works. I mean, this is an evidence-based program. We know that the research out there supports, you know, implementing this program the way it's done, why it's done the way it is. But what we are aiming to do is to show that this program works here in our community in Prince William County, in partnership with Mason, in partnership with the healthcare systems in our community, because that's really crucial. It's that clinic to community care and the partnerships that we build, because that's the foundation of this program, is having that clinic to community care, that continuum where we work together to support the patient to reach their health goals, and just improve the community in general. So I hope that answers the question. We will continue to do the research for sure, because this really is the beginning, and there are so many possibilities for expanding and creating not only a service to the community and the individuals that we are able to impact, but by also impacting, whether it's students getting an opportunity to practice, in real life, get that interaction and that experience in the lifestyle medicine, and, or, having the faculty and the staff be able to contribute to this field of knowledge. And there's a lot of potential there to do that. But again, we're at the beginning stages, so we just kind of need to start to get out there and talk to people.
Thank you. Does anyone else have any questions that they would like to ask? All right, I think that might be it for our questions. Do you all have anything else you'd like to add? I know we've talked about goals for the future. Do we see this staying virtual through the pandemic? And then when the pandemic's over, do you all think the virtual aspect will stay as part of it in conjunction with in-person?
Robin, you want to answer that one?
I can certainly, either one of us could answer this. What we've learned let's take a positive approach to this. What we've learned is that we probably will absolutely do a combination. If the accessibility is better served through meetings like this, and some things coaching through Tammy that she does, I think she's found that it's been much more effective and productive. So I think the answer would be yes, we would do both. And Tammy, I don't know if you have and can share the one prescription comment philosophy about if there was one prescription that could prevent disease. It's kind of like the philosophy of the program that really embraces everything. Part of your PowerPoint.
I think I'm locked or something. Oh, there we go.
There you go. This is like, really, this is it. So it's a great way to just really grasp what exercise as medicine is.
Yeah, I love this quote. That's why I keep it there, because it's a great quote. I usually have a goofy little picture up there too that has a little prescription bottle that says prescription or like prescribed freedom. That's a plug for the Freedom Center, being a source for the exercise medicine program. There's a whole lot of cheesy sayings I could come up with that go with that. But yeah, this has been an incredible experience, I think, for all of our team involved, and we certainly invite you to reach out and contact us. Number one, like, we have folks that are interested in themselves and being a participant of the program, so definitely reach out to us, and we'd be happy to get you started. But also, definitely, if you have questions about anything about the research, about partnering or contributing or wanting us to contribute to your organization or department, we would love to entertain those conversations. So we welcome that. But I also, in closing, just want to thank you so much, Carrie, for the opportunity to come speak. Thank you for inviting us, and to those of you who are here today for taking the time. Hopefully you're eating as well, taking care of those needs. But we appreciate you being here. So thank you.
And thank you both, Robin and Tammy. This has been a great presentation, and thank you all for joining us. And with that, I'm going to close it out. So everyone have a wonderful day and a wonderful weekend.
Thank you.
Thank you. Bye.